Health promotion is one of the cornerstones of our nursing practice. It's not just about treating disease. It is about empowering patients to make proactive lifestyle changes that lead to improved overall well-being. Think of health promotion as a philosophy that embraces wholeness and wellness, aiming to support our patients in achieving the best possible quality of care. Over the past 2 decades, there's been a significant rise in public awareness regarding the connection between lifestyle habits and health outcomes. Today, our patients are much more informed about the benefits of regular exercise, proper rest, balanced nutrition, and limiting harmful substances like tobacco and excessive alcohol. Consider how adapting a regular exercise routine can reduce the risk of cardiovascular diseases. This awareness underscores why, as nurses, we have a crucial role in educating and guiding our patients toward healthier lifestyles. Health promotion is not a one-off event. Rather, it's a continuous, dynamic process. As nurses, we blend the art and science of care by supporting our patients through ongoing behavior changes. This process involves multiple strategies that address various determinants of health, ranging from social and economic factors to environmental influences. For instance, a nurse might develop a community exercise program or provide a one-on-one counseling to help his or her patients manage stress, thereby promoting sustained health improvements. Before we proceed, it's important to define some key terms. Health promotion. This is the process that enables individuals to gain control and improve their health, combining education, supportive interventions, and environmental changes. Disease prevention. These are specific interventions like immunizations and screenings designed to reduce the risk or the progression of illness. Holism. This approach involves treating the patient as a whole, considering physical, emotional, social, and spiritual dimensions. Homeostasis. This refers to the body's ability to maintain a stable internal environment despite external changes. Understanding these definitions helps us frame our approach to patient care and education. Now let's talk about the dimensions of individual health. Every person is unique, and their individuality includes several components. Total character. This includes the behaviors, emotions, attitudes, values, motives, abilities, habits, and even physical appearance. self-identity. How a person views themselves is a distinct, unique entity, both independently and in relation to others. Perceptions. The way individuals interpret their environment, which influences their thoughts, feelings, and action. For instance, our patient's cultural background and personal experiences shape how they perceive health information. By assessing these dimensions, we can tailor our interventions to meet each patient's specific needs. Holism is a fundamental principle in nursing. It means that we care for the entire person, not just isolated symptoms. When we adopt a holistic approach, we consider all aspects of a person's life: the physical, emotional, social, and spiritual. For example, when managing a patient with a chronic illness, we don't only focus on the physical treatment. We also address emotional support, social connections, and even spiritual care. This comprehensive view enables us to design care plans that truly support overall well-being. Now let's discuss homeostasis. Introduced by Cannon in 1939, the concept of homeostasis describes the body's ability to maintain a relatively constant internal environment despite external changes. Cannon noted that this doesn't mean the body is static. Rather, conditions such as blood oxygen levels, blood pressure, body temperature, and blood glucose can vary, but they remain within narrow, optimal limits. This dynamic equilibrium is essential for proper cell function and overall health. When our body temperature fluctuates, even just slightly during the day, it stays within a range that supports normal physiologic processes. Physiologic homeostasis is about maintaining a stable internal environment, critical for cellular function. Here are its key characteristics. Self-regulating. In healthy individuals, homeostatic mechanisms operate automatically to maintain balance. Compensatory. These mechanisms counterbalance abnormal conditions. For example, when exposed to cold, our blood vessels constrict and we begin to shiver to generate heat. Negative feedback systems. Most homeostatic responses work via negative feedback, meaning that when a variable deviates from its set point, a corrective mechanism is triggered to return it to normal. Multiple feedback loops. Often, several feedback mechanisms work together to correct a single physiologic imbalance. An everyday example is how our body responds to a drop in external temperature. Through shivering and vasoconstriction, it maintains a stable core temperature. To further understand homeostasis, it helps to view it in terms of a system. In any system, there are three fundamental components. We have the matter. This is the physical substance such as the human body. Energy. This pertains to both chemical and thermal energy required for bodily processes. Communication refers to the signals, particularly via the nervous system, that coordinate responses. Living organisms are open systems, meaning they continuously exchange energy, matter, and information with their environment. For example, when we eat, food enters the system as input. It is processed through digestion or the throughput and results in outputs such as the nutrients and waste. Feedback mechanisms then ensure that any deviation from the norm is corrected, predominantly through negative feedback. An example is the regulation of blood calcium levels via the parathyroid hormone, which adjusts secretion based on current levels. Our bodies are in constant interaction with the environment, adapting as needed. Take hypoxia, for instance. This is the condition wherein there is a shortage of oxygen that leads to an increased production of red blood cells and a faster heart rate to improve oxygen delivery. For nurses, assessing environmental factors such as room temperature, noise, or even emotional stress is vital. By understanding these factors, we can implement interventions such as teaching stress management techniques to a patient experiencing anxiety to help maintain or restore homeostasis. Now let's explore the levels of prevention. These are integral concepts to health promotion. There are three levels of prevention. First, we have the primary prevention. These are measures taken to prevent the onset of disease. Secondary prevention focuses on early detection and prompt intervention to halt disease progression. Tertiary prevention aims to restore optimal function and manage complications after a disease has developed. Each level of prevention plays a unique role in promoting health and preventing illness. And together, they form a comprehensive strategy for maintaining well-being. Primary prevention involves actions designed to prevent disease before it occurs. Examples include immunizations, health education programs, and lifestyle modifications, such as encouraging regular exercise and a balanced diet. For instance, teaching a patient about the benefits of a low sodium diet to prevent hypertension is a primary prevention. The focus here is in reducing risk factors and preventing disease onset. Secondary prevention is about early detection and intervention. This level includes routine screenings and diagnostic tests, such as mammograms or blood pressure checks, which can identify health issues at an early stage. Early intervention, like promptly addressing high blood pressure, can significantly improve health outcomes and prevent further complications. The goal is to catch problems before they become severe. Tertiary prevention focuses on managing and mitigating the long-term effects of established disease. This involves rehabilitation, chronic disease management, and support services. For example, after a heart attack, patients might participate in cardiac rehabilitation programs that include physical therapy, dietary counseling, and ongoing medical management. These interventions help restore function, reduce the risk of future complications, and improve overall quality of life. Health promotion is also guided by various theoretical frameworks. Needs theories like Maslow's hierarchy of needs help us understand the progression from basic physiological needs to self-actualization. Kalish's adaptation of this model adds stimulation needs between the basic physiologic and safety requirements. Additionally, developmental stage theories allow us to tailor interventions based on the patient's age and life stage. These frameworks are essential tools for designing effective, patient-centered care plans. It is important to distinguish between health promotion and disease prevention. Health promotion is a broad, ongoing process that focuses on enhancing overall well-being and empowering patients to lead healthier lives. In contrast, disease prevention involves specific, targeted measures to reduce the risk or the impact of disease, such as vaccinations or screening tests. Both approaches are complementary, working together to ensure that we address health from multiple angles. Effective health promotion requires interventions at multiple levels. First, we have the individual level. This focuses on behavioral change, self-care, and lifestyle modification. The family and community level. We do this by strengthening the support systems and address social determinants of health. The organizational and policy level implements environmental changes and advocate for policies that support health. By addressing health promotion at all levels, we create a comprehensive, sustainable approach to improving health outcomes. As nurses, our role extends far beyond providing clinical care. We are educators, advocates, and facilitators. We empower our patients by teaching them self-care practices and supporting their efforts to lead healthier lives. For instance, when working with a patient at risk for diabetes, we might not only provide dietary advice, but also connect them with community resources like exercise programs or support groups. This collaborative approach is essential for effective health promotion. Let's connect these concepts with the nursing process. During assessment, we gather comprehensive data on the patient's lifestyle, health history, and risk factors. During diagnosis phase, we identify health promotion needs and potential gaps in care. In the planning phase, we develop individualized teaching and intervention plans with clear, measurable outcomes. During implementation, we educate and support behavior change through evidence-based strategies. And in the evaluation phase, we monitor outcomes and adjust interventions as necessary. This systemic approach ensures that health promotion is integrated into every aspect of our practice.